Diabetes at a Turning Point, a bonus live stream. My name is Stefan Scherer. I'm part of the trade and investment team with Edmonton Global, the regional business and economic development agency in the Edmonton metropolitan area. I'm welcoming this morning Laureen Vales, the CEO of Myviva, a provider of a digital health program built by dietitians, psychologists, and kinesiologists in the Edmonton area. Welcome, Laureen. Could you briefly introduce Myviva?
Well, thank you, Stefan. Myviva Plan is a digital health program that's built by healthcare professionals who saw a need to build a system to get individuals engaged and take control of their health. Whether it's preventing or treating obesity, diabetes, or heart disease, Myviva Plan provides customized programming and daily support for users to help manage their lifestyle behaviors, including mental health, nutrition, and fitness habits.
So what are you expecting to achieve with this digital platform, in particular with regard to diabetes and obesity, and how do you think your project can contribute to addressing this global challenge?
So our objective, obviously, is to reduce the incidence of diabetes and obesity. We, in Canada, 9% of Canadians live with either type 1 or type 2, but 30% of Canadians actually live with type 1, type 2, or prediabetes, and 64% of Canadians are overweight or obese. So we have some work to do with respect to helping change the trajectory of those diseases, and that really is what our mission is all about as healthcare professionals.
You are not alone in that, so you have some partners. Could you briefly introduce your partners for that?
Yes, so Dr. Klein has been a physician, primary care physician for Doug? I want to say over 20 years, but I don't want you to throw anything at me in case I'm wrong. And he's equally as passionate about preventing these chronic diseases as well. He, along with many other colleagues within Metabolic Syndrome Canada, have built a program called Change, and I'm going to let him introduce that, and he'll talk a little bit more about it. And then Randy Duguay from HealthGauge. Randy and his team, they're basically tech, what would you call them? Brilliant tech guys who really bring tech to the space with respect to having wearable devices and digital Bluetooth scales that can help us monitor outcomes or specific health outcomes related to blood pressure, heart rate, that type of thing at home. And so together combined, these three entities really create a comprehensive approach to diabetes prevention.
Thank you, Laureen. Good morning, Doug, and good morning, Randy. Let's start with Doug. Can you tell what role Change Alberta plays in this partnership?
Yeah, so Change is actually, so it's a program, Canadian Health Advanced by Nutrition Graded Exercise, and so this is a decade's work of taking the science behind diet and exercise and lifestyle change and integrating it into a package that can be implemented into primary care, into family doctors' offices across Canada and across the world. And so what we know is that with the right support is that patients can improve their eating habits. They can change their lifestyle and be more active, and actually reverse some of those metabolic symptoms that we're seeing in prediabetes and obesity.
Thanks, Doug. Welcome, Randy. What is your company contributing to the program?
Well, I'm really pleased to be part of the initiative with Laureen and Doug. And so when we think about what people are looking for in support, we're working on the latest digital technologies. And so this is an example of our device, but more importantly, we're capturing electrocardiogram, digital pulse, activity, and other biometrics. And so when we bring that together in an affordable, regular routine and associate that with behaviors, we're really also able to provide that input to the care team and to Laureen's organization who can help their clients on a more regular and quicker basis. And so we're really providing for that artificial intelligence, machine learning, and mobile applications to enhance the connectivity with resources such as Doug Klein and Marine Whales.
Thanks for that. You mentioned that the program is evidence-based and clinically validated. Can you share at what stage the clinical validation for the digital health program is right now?
So we've done one randomized controlled trial with Carla Prado at the University of Alberta, and we were specifically focusing on first-year university students from a prevention perspective. Our program, I mean, as healthcare professionals, as a dietitian, everything that we do is evidence-based. We use clinical practice guidelines to guide our practice, and we really took everything within clinical practice guidelines, so the obesity guidelines, diabetes guidelines, heart disease guidelines, and we've integrated that into our program. So when we talk, and we use it in our day-to-day practice as dietitians at Revive Wellness. That is our bricks and mortar clinic that's been running since 2006, and this is what we've used in our practice. So we're really big on and very particular about making sure that we use evidence to support everything we do in our practice.
So in terms of what are the next steps for this partnership between all of you to get this project implemented?
So maybe I'll jump in. So what we've got is we know that we've got this healthcare system that can make a difference if we support the population in an effective way. We have dietitians, we have exercise specialists, but we actually don't have enough of them to support them in our sort of traditional manner. So as if we're meeting people one-on-one, face-to-face, we don't have enough staff to make that to work with people, to be able to give them the support that they need to make those lifestyle changes. And so that's where Myviva plan is that combining the system in primary care and the health system with a digital platform with Myviva plan is that we extend the reach of our dietitians, our exercise specialists, our health professionals to way more people across the country and across the world to make those lifestyle changes. And then we add in Health Gauge, which gives us really accurate data that can help inform Lorraine's team, the health professionals with change to make the best decisions for the patient as far as medication management or particular dietary or exercise recommendations.
I think one of the reasons why it's such a great opportunity for us in working together and working in a place like Alberta is that we have significant resources and talent in areas such as computing sciences, health sciences, and a broad single type of health system. And the world is really looking for organizations like ours to bring together a full stack solution in the latest generation of digital technologies. And this is why it's just fantastic that we can work together on an initiative like this in a province that is investing in these kinds of solutions and ideas. Data and people are really looking for more information and better connectivity, not just on telehealth-based solutions, but in physiological information, behavioral information, and to more rapidly communicate and integrate together.
So what is the impact you hope to achieve with that? Maybe start with Lorraine.
Well, the impact we hope to achieve, obviously, is to reduce the trajectory that we are on with respect to the incidence of these chronic conditions. It's costing our healthcare is over 11% of our GDP in Canada. We simply can't afford it. And one of the things that I've found as a healthcare professional and practicing for 24 years is the conversation that we haven't been having on a regular basis is getting individuals engaged in their health. Well, the reality of these chronic health conditions is that we have to get individuals engaged in our health. We need individuals to, but as healthcare professionals, we need to build tools and use, which in the form of technology, like Myviva, as well as the health gauge devices, that can help support the clinicians like Dr. Klein, the dietitians, the kinesiologists, as well as the patients, to be able to help them manage their health. And so it's creating that ecosystem, that collaborative approach that is really needed to help reduce or improve the trajectory that we're on.
So if I'm looking at it, the digital health platform seems to be geared towards people which are technology savvy. What is with the rest? Any thoughts on that?
Oh, okay. So, Stefan, I am the least technology savvy individual out there. And I was a big part of building this with the engineers. And my biggest emphasis was we have to keep it simple because it really, like, the more complicated we make it, to your point, the less likely people are going to engage. So it is really focused on keeping it simple. You can use it on your mobile device. You can also use it on desktop. So it is very flexible in that respect. And people of all ages actually can engage. And I know that they're, so I'll stop there.
And what we know from other technology that has been out there around monitoring health is that sometimes wearables can actually be used and be effective in transmitting data without actually the individual being that technologically advanced. Is that they could be wearing a health gauge device, and that data can be coming to me, the health their family doctor, and we can even pick up a low-tech version of a telephone call to that patient to discuss some of their progress and where we go from there.
I'd like to comment on the simplicity of it too. It is hugely important to have solutions that are really easy to use. And one of the great things we have today too is that we can make these incredible interfaces that are both quickly intuitive, but also engage people faster. But we're also kind of looking to people to step forward into collecting information that supports them in their health journey. So there is a little bit more understanding, and the tools support that understanding, both individually as well as in engaging with their care providers.
Rennie, on the technology side, one question I would have for you. Sure. Edmonton is one of the Western hub in the Pan-Canadian AI strategy with Alberta Machine Intelligence Institute, with the university and their accomplishments in computing science, Alta ML companies are around here. Does artificial intelligence play a role in the sense you're using?
Well, absolutely. And it's a very significant opportunity to take this health information in a secured and protected environment, and to apply machine-based algorithms in ways that's never been possible before. And so this is a big part of what our company's doing, and absolutely we're a participant with many other companies in Edmonton and Alberta, and frankly across Canada. Canada has an incredible and growing reputation, but Alberta has a lot of leadership in these areas in a broad way, and not just in the software and artificial intelligence and machine learning, but also in biomedical and engineering and the health sciences area. So it's a very, very good place to be innovating, and holds tremendous promise in serving individuals and in helping speed up the serving metabolic syndrome issues such as what's being discussed here.
Well, and just to add to that, we've integrated augmented reality. We built a virtual reality avatar with a grant from Roche Canada in conjunction with the Faculty of Rehab Medicine Robotics Lab to help with behavior change and to get people, so adding a little bit more of that gamification piece of it. But as healthcare professionals, we have to be so careful as to how we actually do this in a way to get people, we know behavior change is challenging. How do you get people engaged in it and have some fun with it without actually creating negative habits or negative addictions like some of the gaming programs out there do. So I think to Randy's point and Stefan, to your point, AI and virtual reality are going to absolutely be a part of the future for us in this endeavor.
You are in the right place for that.
Yeah.
Yesterday, the Apple Store announced that they're implementing stricter rules on using personal data on application. Is that something which poses some obstacles for your platform going forward?
Well, again, as healthcare professionals, if there's one thing that I've gotten very used to is annual external penetration testing, security and privacy policies, making sure that we're PIPEDA and HIA compliant. When it comes to it's no different than what Dr. Klein and I do in our daily practice. I mean, we as custodians of healthcare data have to follow all of the rules, and I would say that if there's that's something that we are really proud of as healthcare professionals, because if there's one thing to be proud of being anal about, it's about making sure that the data is secure, and that if we are going to share it with data of Dr. Klein's clients with Dr. Klein, that his patients are well aware that we are doing it, and that that system and process is safe and secure to do so.
So we're getting to the end of our short session, and I want to give an opportunity for everybody to have a brief statement at the end and leaving the listeners with. So what do you think is what they should remember about the platform from each perspective of you?
Doug, you want to go?
Sure, I'll get started. Is that I think that what I want people to take away from is that the systems are available to help you make behavior change, and that we do know that we have the ability that we can support and make those lifestyle changes that are so important. I also feel that we need to move forward, is that we spend a lot of time and money treating disease, and through a platform like this, a digital rehab program or a digital metabolic rehab program like this will actually prevent some of those really costly events which are taxing our healthcare system today.
Thank you, Doug. Who's going next? Randy?
I'll let Lorraine wrap up, so I'll just do a short note. So one of the things I really want to leave people with is that we live in an incredible time in how we can improve on health outcomes, as well as addressing the significant costs in our health system today. And to do that by addressing both the prevention aspects as well as the post-event management aspects, as we help people as they go through their lives and in addressing their health journey. Right now, we don't have enough understanding, individually and personally. We don't know enough and how to engage our care providers, and the care providers include the primary care and the allied care providers such as Lorraine. And so information and how we can use computing systems and the most advanced sensors and microprocessors has never been possible before, quite the way it is today. So it's a huge opportunity, and it's important for organizations such as the three of ours to bring that together as a singular concept. So over to you, Lorraine, to kind of like finish on your notes.
So I would have to say that chronic diseases such as obesity, diabetes, and heart disease require that self-management, and the technology can help support both the clinicians as well as patients in managing their health conditions to improve optimal mental and physical health. And without self-management, it doesn't matter how amazing Dr. Klein is, how wonderful of a dietitian that I am, how amazing our psychologists are. We are never going to, it's simply impossible to achieve optimal mental and physical health outcomes without individuals getting engaged in their health. So, and that's what we see with the stats out there when we look at, we've got all these wonderful medications and stuff, and they can only take you so far, and technology can take you so far. So it's that combination, and absolutely getting that the individuals engaged is what matters.
Thank you very much for this interesting conversation, and good luck and goodbye.
Thank you for having us.